Hello, good evening, everybody. I am live on more channels today, just because today we're going to be talking about dental implants and the 5 most asked questions that I get, period, with regards to dental implants. So I thought I'd address them here. It's going to be a quick one, straight to the point, and it's going to really help you out, or someone that you know might be helped out. Today, I am, in case you don't know, I'm Dr. Spinati, and I own a clinic on Hyde Park in Sarnia. It's called Spinati Dentistry. If you haven't checked it out, make sure you do. So I am going live right now on Instagram because that's the one that I have to go and click all these things. But I am live on all these channels for today. Now, what are we going to talk about today? Like I said, we're going to talk about the 5 most asked questions about dental implants. And the first question, we're going to dive right in because I'm not going to make you wait. I appreciate your time. And so we're going to go straight in. We're going to talk about dental implants. Okay, so the first thing I get asked all the time is this: should I get a root canal or should I get an implant? And this is a very common question, probably the most common question, is whether or not someone should get a root canal or an implant. Now, it's common because people think that implants are a lot more superior than root canals. Now, I am here to break that myth because it is simply a myth, and that's not very true. Now, in any kind of philosophy, root canals, 100%, 100%. If the tooth is savable, if the tooth is not fractured, it's not cracked down the middle, if it is actually savable, like there's enough tooth structure for a crown to be put on, hands down, all the time, every single day, root canal is the best option. Now, the reason is because root canals, they last you a lot longer, or they should last you a lot longer than dental implants. Now, even if dental implants, or rather root canals, don't last you as long as dental implants. Let's say, for instance, you have a tooth and it's a little bit questionable, but it's restorable. You do a root canal. Obviously, the dentist or the endodontist, the specialist that does root canals, will not do the root canal if they deem that tooth to be very poor prognosis, or the chances of it to succeed is very, very low. So they'll only do it if it has a good prognosis or a good chance of survival. And they will give it a good chance of survival if they deem it, according to their diagnosis, if they deem it to survive at least 5 years. Now, if something can last 5 years, more than likely it can last a little bit longer than that, maybe 10 years, 15 years, 20 years. I've seen root canals that lasted 30, 35 years. And then they needed to, either the root canal needed to be redone or the crown needed to be redone, but it's not that the tooth needed to be extracted. So here's the thing: if you need to get a root canal done and you can save the tooth, your dentist says, yes, you can definitely save the tooth, then it's 100% better. So number one is that it lasts you a lot longer simply because it's your tooth and your bone. Number two is that the teeth themselves, your teeth, preserve bone much better, like by an nth degree, much better than the alternative, which is dental implants. Because as soon as you extract the tooth, bone resorption or bone remodeling starts to happen. And so if you put the implant in, there's still going to be a little bit of bone remodeling. It's not going to be as much. But if you don't take out the tooth, if you leave the tooth where it is, you do a root canal, all the ligaments and all the fibers around the tooth are still there holding the tooth, and everything around it and your immune system is all protecting that tooth. So much better for your bone. Okay, so in terms of your tooth lasting longer, much better. In terms of it being better for your bone and preserving your bone, much better. In terms of it having proprioception is you actually feeling the tooth. Like, I mean, when you're biting on something, like the pressure. So when you tap it, or when you put like food on it, there's a feeling about it. There's a feeling, there's a pressure. But with implants, you don't have that. And the reason is that with dental implants, the implants actually fuse like a rock, is like not a rock, rather like a pole inside the earth. When you put the pole in to, let's say you're doing a fence, you put a pole in, you put cement. It's exactly like that. It's literally the exact same process, right? So the implant becomes literally fused with your bone. So there is no give. Now, the good thing about having your tooth in your bone is, as opposed to an implant in your bone, is that the tooth is a lot more forgiving with pressure, with different pressure forces. So if there's a lot of pressure force on that single tooth, your tooth itself is a lot more forgiving than the implant is over a long period of time. So the tooth will actually survive longer, whereas the implant may not survive as long. And that's why when we have an empty space of an implant, we put two implants and we bridge them together. And the reason why we bridge them is because we want to give them more strength when it comes to the force of your chewing. We call that the masticatory forces or the occlusal forces. Okay, so we try to increase the amount of occlusal force that can be taken by the implants by bridging them together. Okay, so the strength of the tooth, the preservation of the bone, proprioception, and it lasting you longer, those are all advantages for you to actually keep the tooth as opposed to doing the implant. Now, let's say you're like, okay, well, what if I need the implant later on? That's exactly why you should keep the tooth, because keeping the tooth means that you are keeping whatever you have in your bone. So you're not going to replace anything. You have the exact same thing. You just do a root canal, remove the infection, you put a crown on there. And then later on, let's say 10, 20 years down the road, then you need an implant. Then at that point, for sure, then at that point, you would have used the tooth to its most maximum lifespan. Then you take out the tooth, you put the implant in. And the other thing is with implants is that implants, according to the studies that are available to us, implants last between 20 to 25 years, right? So after that, you get failure rate of implants where the implants don't actually stay. So with that in mind, you want to delay putting in the implant as long as possible so that when you do put the implant can outlive you, right? As morbid as that sounds. All right. So that answers the first question. And that took 7 minutes for some reason. All right. Now, the second question that I get all the time is, what does it feel like to have an implant inside my bone or inside my jaw? What does it feel like? And as you can see here in this picture, you can see there's an implant in there, and adjacent to it or beside it, you'll see a normal tooth and a normal tooth. Now, you also see the tissues and how the tissues are formed. Now, the tissue actually forms really well around the crown of the implant. It really does form well, and you can see it there. Okay, so that's shaping of the actual place where the crown is going to be put in on top of the implant. How does it feel? The feeling is different from the sense that you're not going to feel any cold, you're not going to feel any heat, and you won't feel any pressure. So you're not going to have that tactile sensation. But everything else in terms of function, in terms of look, in terms of how it is around the gum, if it's put in properly, then, as we call the emergence profile, how it comes out from the gums, that all pretty much looks the same. So that's the only difference, really. So in terms of, when someone's asked me, how does it feel like? I haven't had yet, or I haven't heard of, literally anyone complain of having a dental implant. Literally. Okay. Whoever puts dental implants, they actually love them because they are an amazing replacement. They're the gold standard in replacing a missing space, a space that you have because of a lost tooth. They are the gold standard right now in dentistry. And so when you get them, you just enjoy it, right? Because it's there, you have the function, you have the look, everything is great, you can actually eat properly, and the way that you maintain it is very, very similar. Now, the only difference between the maintenance of the dental implant and your tooth is in the way that you clean in between your tooth and the way that your hygienist would clean the implant. So the implant cannot be cleaned with the same type of instruments that you would clean normal teeth. Okay, you need a specific type of instrument, titanium instruments, in order for you to remove any debris around the implant, because you don't want to scratch the implant. Okay, you don't want to introduce any scratches, because if you scratch the implant, then you're actually introducing areas where bacteria can then really hold on, and then you can develop something called peri-implantitis, which is infection around the implant. So you want to prevent that as much as possible. So when you go, to your hygienist would know, and you can remind your hygienist would know or should know that they don't use the same instruments around the implant as they do around your teeth. That's one. Two is when you're flossing your teeth, you don't want to floss all the way down into the implant. Okay. You kind of just want to break you want to get down to the crown, and then that's it. You want to stop there. And the only reason you want to do that is because the way that your gums are actually attached to the side of the implant and even a little bit to the crown is it's kind of like it's basically like they're attached to it, right? So if you're breaking that attachment, then you're introducing problems, and you don't want to do that. So that's the only difference between implants and your teeth, is that your teeth, it's highly recommended for you to go as far down as possible, because the protection of your tooth, that what it has is it has these microfibers, what we call periodontal ligaments, these very, very small attachments in between your tooth and your bone, and that protects your tooth. So you can go literally as far down as possible to remove any of the debris. But with regards to implants, you don't want to do that. You want to stop just as soon as you get to the crown, just a little bit underneath it, and then you stop. You don't want to go all the way down to the implant surface. Okay. So that answers the question with regards to how does it feel like. Now, third question. How long does it take to put in the implant? Now, from start to finish, you're talking around 2 to 3 months, depending on the stability of the implant. So let me explain. From the time of surgery, so let's say, for instance, you go in and you get your implant put in, let's say tomorrow, and let's say the stability was great, okay, and your treating dentist or surgeon can let you know how the stability is, and they'll let you know, according to their estimation, how long is it for you to wait until you can get the crown. But let's say, for instance, it's average, and they say we're going to wait 3 months for the implant to heal around the bone, and so I need you to come in after 3 months. So 3 months later, you come back, they take an impression of the actual space of the implant. Okay, so they take an impression, and then 2 weeks after that, then you would come back and they would put the implant in. Now, if they're doing the implant crown in the clinic itself, then it would be the same day type of thing. But either way, you're waiting around 2 to 3 months. Okay, depending on the stability of the actual implant. Okay, and depending on who you see, because sometimes some people can, depending on what technique they're using, they can do it a little bit, a shorter time frame. But it is recommended still to wait as long as possible, so that the implant, and by long as possible, I mean 2 to 3 months, so that the implant can fuse as part of the bone, and then you have a higher chance of success with regards to loading that implant. Okay, so that answers the question with regards to how long. We're rolling along. Now, this is something else that I get really quite often when I'm suggesting treatment, different kind of treatment options for missing areas when someone needs to, lose a tooth or extract a tooth or whatever, is they tell me, especially, people that are above 60 years old, they say, well, I'm 60, I don't know how long I'm going to live. And so, dental implants are not for me. They're meant for younger people. Now, that's a huge misconception, because dental implants are actually meant for people that are of that age category, right? That are 55 and older. And the reason is because at that age is when people start losing teeth. So the implants are actually made for that age group. So, and if you look at the studies, around 50% of the population are in that age group that had dental implants. So the majority of people actually have dental implants in that age range. And implants have advanced so much that they actually last very, very long. They last a very, very long time. And so there isn't that fear that, if you put an implant in, you're going to outlive the implant. Okay. So that deals with that question, because I really get that a lot. Okay. Now, last but certainly not least, probably the one that you've been waiting for, and I'm sure that's the one you were anticipating, is the cost. How much does it cost? And as the slide here says, it really depends. Depends on the area in which the implant's being put in, because different areas there's different degrees of difficulty. That's one. Two, different areas also require different types of procedures. So some areas require more bone, right? So if you've left that space for a long period of time and your bone has shrunk, well, you're going to need bone graft. You're going to need a gum graft. That costs a lot more, much more, if you're just to put the implant in, let's say after you extract it, and you do, in let's say 2 months after you put the implant in, you require a lot less kind of work for that implant, depending on the area and depending on how much bone you lost. But generally speaking, you require a lot less work than if you were to actually if you were to wait for a very long time. If your sinuses have dropped, okay, if your sinuses have dropped, then you're going to need something called a sinus lift and grafting. So it really depends. But if you were just to get a straight up, and here's another thing is, if you require any kind of orthodontics like braces or Invisalign prior to doing any implants, and I've had several patients in that category where we couldn't really put an implant in, we had to create some space, and so we needed to use orthodontics to create that space, and then we were able to put implants in those areas. So that also adds the cost. And whether or not you're getting a zirconia implant, which is the white implant, or titanium implant, which is the traditional metal implant, then that also, raises the price if it's zirconia. So if you were just getting the traditional implant and just an implant, let's say we're assuming no grafting, there's no complications, it's a straightforward implant, then you're looking at a range, depending on who you see, you're looking at a range between $5,000 to $6,000. Okay, that's how much it costs for a dental implant. And that's it, ladies and gentlemen. I hope you enjoyed it. It's been a pleasure. And now the final slide is, if you want more info, make sure that you get on our email list, info@spinatidentistry.ca. We're, putting out a lot of good things in terms of information, in terms of offers, and it's only exclusive to those people that are on the email list. You won't hear it on social media. You won't hear it on these podcasts. It's exclusively to people that are on the email list. So if you want these types of emails, really cool information, amazing offers, then go ahead and join that email list. And then you can join the crew, the Spinati Dentistry crew. If you have any questions, you can also email that email. You can email that email. You can use that email, and then you can send out any kind of questions, and we'll be more than happy to assist you with those. Thank you so much. Have yourself a great night, and as always, keep smiling.